All right, welcome to the deep dive. Today we are jumping straight into a topic that came from a listener, Jocelyn.
Yeah, this one was interesting.
She saw one of those viral posts online making a pretty scary claim that getting frequent cold sores, lip herpes, has this secret link to brain degeneration.
Specifically to Alzheimer's disease.
Exactly.
Yeah.
And it sounds like pure clickbait, but it's actually rooted in a very real, very intense academic debate. So our mission today is to walk you through that and maybe raise some awareness about critical thinking when you see these health claims.
And the main player here is a virus called herpes simplex virus 1, or HSV1. That's what causes cold sores.
Okay.
The thing to get right off the bat is that even scientists are completely split on this. It is highly controversial. Some really smart people think it's a major driver of Alzheimer's.
And the others.
Others look at the evidence and just say, it's not there.
Okay, so let's unpack that. Let's start with the side that does see a link. There was a big review paper recently suggesting HSV1 really could be a driver for Alzheimer's. And the mechanism they propose is, well, it's not pretty. The idea is that the virus reactivates in your body over and over again, causing this kind of chronic inflammation in the brain.
Right, a sort of slow burn.
A slow burn that helps build up those classic Alzheimer's proteins, the beta amyloid and tau.
But here's the thing. Almost at the same time, another massive review looked at, basically the same body of evidence and came to the complete opposite conclusion. They said the evidence linking herpes viruses to dementia risk is, and I'm quoting here, insufficient.
Wow. So two expert groups, two totally different answers.
It's pretty remarkable.
This is where it gets really fascinating, though. When you look at the big population studies.
The cohort studies.
Yes. So a 2018 Taiwanese study found that having an HSV infection could increase your risk of dementia by like 2.5 times.
Which is a huge number. But they also found something else.
The bombshell, right. That taking antiherpetic drugs, the antiviral pills, seemed to slash that risk by 90%.
A massive, massive reduction. But then you have to contrast that with a U.S. veterans study from 2021.
Okay, what do they find?
They found no increased risk of dementia from the virus at all.
Oh, so they completely disagree with the Taiwanese study on the risk.
Completely. But, and this is the craziest part, they agreed that the antiviral drugs seem to have a protective effect.
Wait, hold on. How does that make sense? How can a drug protect you from a disease that the virus isn't even causing, according to their data?
That's the million-dollar question, isn't it? It just screams correlation, not causation.
Right. These are just observational studies. They're looking at patterns in a database, not proving cause and effect.
Exactly. The ultimate proof. I mean, the gold standard is always a randomized controlled trial, an RCT.
So did they do one?
They did. And the results were really clear. The antiviral treatment completely failed to slow the development of early-stage Alzheimer's disease.
It failed. Full stop. So for you listening, the person who saw that scary post, what does all this mean? We've got conflicting data, a failed clinical trial.
Yeah.
Why are the experts so skeptical?
Well, there are a few big reasons. First, as Dr. Shion-Scales points out, we have 14 established risk factors for dementia. Infection is not one of them.
Okay, so it's not even on the official list.
Not right now, no. And then there's a clinical point from Dr. Clifford Siegel. He says, look, we know viruses can cause sudden severe brain issues like encephalitis.
Confusion, brain damage.
Yeah. But that's a world away from the slow, creeping memory loss of a degenerative disease like Alzheimer's. He says linking the two just isn't supported by what doctors actually see in patients.
And there's that one statistic that it floored me from Dr. David Vickers.
Oh, yeah, that's the big one.
He pointed out that 99.56% of all Alzheimer's cases do not involve HSV1 infection in the brain.
Let that sink in. Less than half of 1%. It makes you think the link, if it exists at all for a tiny few, has been wildly overstated for the general public.
So we went from a sensational Facebook post all the way to this incredibly complex and messy scientific debate.
Which is how science often works. It's not clean.
The key takeaway really seems to be that correlation is not causation. Yeah. And getting real proof takes a long, long time.
Right. And if we want to connect this to the bigger picture, here's something to really chew on. Even with that failed clinical trial, we still have those big studies showing some kind of protective effect from antivirals.
Yeah, that's the confusing part.
It is. We still don't really understand how that protection works. Is it the drug? Is it something else entirely? It really forces you to think about the vast difference between just managing a common virus and truly treating a devastating degenerative disease. And that nuance, that's where the real story is.